Hi, I'm Stephen Jones. At Robert Wood Johnson, we believe citizens need to be informed about the important healthcare issues affecting their lives. That's why we're proud to support the healthcare programming produced by the CAUCUS Educational Corporation.
Treatment options for opioid addiction next on CAUCUS New Jersey.
Funding for this edition of CAUCUS New Jersey has been provided by Steve and Elaine Pozycki, Wells Fargo, Caldwell University, PSE&G, committed to improving New Jersey's economy and strengthening its communities. Robert Wood Johnson University Hospital, the heart of academic medicine. The Robert Wood Johnson Foundation. And by Oscar Health Insurance. Promotional support provided by NJ.com. Small news, big news, true Jersey. And by NJ Biz. All business, all New Jersey.
Welcome to CAUCUS New Jersey. I'm Steve Adubato. The rise of opioid-related addictions can not only be seen in New Jersey, but across the country. Here to discuss this and the resources to help in the recovery process, we have Dr. Louis Baxter, Sr., Executive Medical Director of the Professional Assistance Program of New Jersey. Our friend Carolyn Beauchamp. Well, you're all friends, but I just want to acknowledge Carolyn, who is the President and CEO of the Mental Health Association of New Jersey. Tonia Ahern, advocate and mother of a son with a substance abuse disorder. And finally, Wayne Wirta, President and CEO of the National Council on Alcoholism and Drug Dependence in New Jersey. I want to thank all of you for joining us throughout this program. You're going to see important information down the bottom of your screen as to where you can get important information. An opioid. What is it, doctor? I don't want to assume anything as to what people know.
An opiate is a chemical that was originally developed to help us manage pain. Opiates are synthetic, opiates are natural, they are medications that are used to address pain.
When did they get prescribed?
I'm sorry?
Under what conditions did they get prescribed?
Well, unfortunately, they are prescribed too often, in my opinion. But they are prescribed sometimes post-dental work, even extractions. Certainly dental surgery would qualify. And they are prescribed for other acute traumatic breaks or post-op surgery.
Carolyn, what is the connection? We've had lots of offline conversations. We partner with the Mental Health Association on a lot of seminars and forums outside, and we're doing some of these programs together. What is the connection between opiates and mental health?
They are closely connected. We call it co-occurring disorders.
Co-occurring disorders. Go ahead.
And Mental Health Association in New Jersey has had information and call lines for now 10 years. And we provide support, information, which means a very big database. And as we've gone and proceeded to serve people and help people figure out where to go, what the issues are, we have found that an enormous number of people who call us for help with mental health also have a substance abuse problem. So what we've seen now with the opiate crisis is that we now have a call line just for opiates. At least 60% of the people calling us around the opiate needing information, help with treatment, all of that, family members calling, is that there's a 60% occurrence of some kind of mental health issue. So it's both probably depression, anxiety, not so much the serious mental illnesses, but some of the other kinds of mental health problems that really need to be treated along with the opiate addiction.
Define the crisis. There's an opiate crisis. Describe it. Take a shot.
I just talked to Director Botticelli, who said they have 120 people a day dying.
120 people a day.
That's a crisis.
Your story, share, please. And thank you, by the way, for being with us.
My son, actually was diagnosed as ADHD when he was young, late. So we didn't really realize what was going on. And he found opiates through, at school, kids exchanging medications, experimenting. But what happened was, it made him feel better. It seemed like for whatever reason, he felt good. So he went from, to pain pills, those kind of things, went on to, first started with ADHD medications. He started experimenting. He didn't like what we gave him. He went on to something else.
They were accessible?
They were accessible. I mean, we've done a lot. Advocates have literally been doing a lot about, locking up medications, don't have medications in cabinets. I mean, I know for sure that, one house where they were getting pain medications.
Another home in the community where kids, about how old were they?
16, 15, 16. Some are even younger now. I mean, it's scary.
And they were getting
they were just
prescription medication?
Yep, they were getting, and what was happening too is once kids started learning about it or found out somebody had it or their parents had it, then they started selling it to them. So they're 15 years old, basically, you call them dealers, I guess you could say, but they're selling them to each other.
But how does it go from pain pills or painkillers to heroin?
The cost of these pills was so high, and these kids didn't have the money for the pills. And as you build your tolerance, you need more. So when you're looking at $30 a pill, and you've got a habit where if you stop, you get sick. So you need to keep taking the medications because you're sick. You go, heroin's so accessible, and heroin is, I think right now it's like $5 a bag.
Cheap.
Yeah, it's very cheap. So it just kept going from there, until eventually he was shooting heroin, which, they all think they'll never do that, and that's what he ended up doing. So it was a struggle.
How's he doing today?
He actually, for today, he's good. He's on a medicated-assisted treatment.
Say that again.
He's on medicated-assisted treatment, so he's on Suboxone. I always forget the name.
Buprenorphine.
Thank you. I remember it, but I can't say it.
But is that significant?
It is. I mean, for him, it worked. I mean, there's several different types of medicated-assisted treatment you can use. For him, methadone is something that you have to go every day to get from a physician's, which was hard for him with his job, and hard for a lot of people transportation-wise. Vivitrol's another one that you do a shot once a month, which is great, but you have to, liver enzymes have to be right.
But Suboxone's working for your son.
It is. He's tried it in the past. It didn't work, but it seems to be.
Is there some pushback here, Wayne, on the part of some?
Yes, there is.
Based on what?
In the traditional kind of old-time recovery community, you have to realize that probably 30, 40 years ago, and even to this day, Dr. Baxter can speak on this, physicians, psychiatrists did not get any training back in those days about addiction. And so it was very common for people who had an addiction problem to go to their physician and go to their psychiatrist, never be asked about what they were drinking or taking. Riley Regan, former director of addiction services, used to say he was tired of women with alcoholism being treated as if it were a Valium deficiency, because they would be put on barbiturates, which is another addicting drug. And so I think it left such a bad taste in the recovery community of all the misdiagnosis and all of the being given other addictive drugs that there was sort of a pushback that said, some in the very extreme, that you shouldn't take any drugs no matter what. I mean, that was the very extreme. But certainly people saying any kind of drug that even smells psychoactive in any way, no, it's bad, you shouldn't do that.
And what's the downside of that approach?
Well, the downside is you get people who go into recovery, go into the rooms, go into a self-help group, and if they have a mental illness and they need to take medication for that, or if they're successful on methadone and they're not using narcotics anymore, they're discouraged sometimes in some groups, very actively discouraged from continuing to do it.
Because that other medication that can help them with the mental health issue, if you don't prescribe that, then isn't that problematic? I mean, again, we're not here to advocate any particular point of view, but isn't that potentially problematic?
It is very problematic. I could tell you that I've been in addiction treatment for nearly 30 years, and at the beginning of my experience, we were told just what Wayne has said, that under no circumstances do you use any medication.
Any.
And I shudder to think about the thousands of individuals that had I had available the information and the medication, how many could have been saved. And so today, with the knowledge that we have from NIDA, that it's actually it's the National Institute of Drug Abuse, part of the National Institute of Health. We have information ironclad that tells us that it is a brain disease.
Oh, hold on. Addiction is a brain disease.
Yes.
Explain that.
Well, when people take certain medications for periods of time, the brain chemistry changes. And in order to have people get better and to recover, if you will, we have to address those changes that have occurred in the brain. Therapy is very, very helpful, but some of these changes need to be addressed with medication.
Carolyn, there are people watching, parents watching right now, listening to this conversation, struggling, fearful, looking for help for their kids. What should they take from this conversation right now?
They need to be aware of what's very important when they're looking for treatment for their young person. And it's confusing.
It is, right?
We don't have enough treatment centers. We don't have enough treatment available for people. But I think more to the point of what we're talking about here, families aren't aware of the science of what happens to your brain and the fact that if they're going to send someone to a treatment center, they want to be aware and they want to ask questions. You know, if we've gotten a little more sophisticated about mental health. So if you're going to ask somebody and you have the resources, you want to go into a mental health unit, you know what questions you're going to ask, how involved can you be in the treatment, et cetera, et cetera. With this issue, people aren't aware that they need to be asking, is there a doctor within the treatment center?
But hold on, let me be clear. Important questions. Is there a doctor in the treatment center? Go ahead.
Is medically assisted treatment a part of a choice of treatment while people are in rehabilitation?
That's critical.
It's critical because what we find is if people go through a rehab process and there is no medication and they have brain changes that obviously they're not aware of, but hopefully science tells us that's what's going on, they leave there on no medication, not on mental health medication or for opiates. Then they have to handle stress, they have to deal with what they're facing in the outside world. That stress can get extreme for anybody. They can't handle it. They're going to go to heroin. This is what we're seeing, and they can overdose. The problem, one of our problems with heroin is that we don't know how strong the dose is that we're taking. I'm not taking it, but people who are, and we don't know how that's going to affect us. So people overdose, and they're dying. Our young people are dying, and that's what families are so terrified about. And this is one of the ways that we can help contain that while they're going through a wellness process.
Powerful information. Jump in, Wayne.
Yeah, I think that even before that, one of the biggest problems in this country is the stigma associated with both mental health problems and addiction problems.
Still?
Oh, still.
Talk about it.
I mean, it's getting better, but still. But I mean, how that operates at the family level, it becomes very difficult to, first of all, even admit to yourself that your child might have a problem. I mean, that's very hard for anybody. You know, I've had children with problems, and it's very hard to get to the point where you say, yes, this child is not just a little strange or having a bad day. My son, daughter really has some sort of a problem. That's
You've dealt with this head on.
I have, yeah. And then secondly, if you're going to ask for help, you need other people have to know, and that's because of our society very hard. So I think, you know, years ago people wouldn't talk about cancer. It was a big secret. Shameful if you had cancer. Well, you know, still to a degree shameful if you have a mental health issue.
As if you did something to bring this on.
Yeah, exactly. And certainly with the addiction, you know, our country has treated it as if you are at fault and you get put in jail for just being addicted. Let's not talk about the other crimes you might do.
You're not getting put in jail if you have cancer.
No, you're not. You're not.
And this is an illness. And by the way, language matters, doesn't it?
Oh, absolutely.
You told our producers in the pre-interview that there are certain words that you really have problems with.
Yeah, I don't call anyone an addict.
Say it again?
I don't call anyone an addict. I just don't. I mean, it's someone with a substance use disorder. There was a study done, and you may know the study that was done by a doctor where they used certain language in the story, and then they changed the language in the same story, and they had a completely different outcome. I mean, the people thought completely different that read the story.
Just because of the words?
Just because of the words.
Clean, dirty?
Talk
about those words.
Don't read those words. You know, someone in recovery, someone struggling.
Someone's clean.
They're in recovery.
Someone's dirty.
They're struggling. Yeah,
words are powerful.
Words are very
What do they say
powerful.
to the person with a disorder who is struggling and is dealing with it and is aware enough of the potential perception of those around him or her,
Right.
that can't help.
I was just having a conversation with somebody on Facebook who's in recovery. I would call her in recovery. She's on methadone and she's doing very well on methadone. And she was being bullied on Facebook for being on methadone and saying that she kept saying she was clean, she's in recovery. And I messaged her and I said, stop saying clean, even though, say I'm in recovery, because you are in recovery. You have to change the language, and nobody can dispute you're in recovery.
And that's also a significant problem in the treatment field, is that we still have providers who actually use that language.
Providers.
Providers, counselors, physicians, psychiatrists, because when you use that type of terminology, it takes the concept away from it being a disease. It goes back to being willful misconduct.
As opposed
to being
a disease
a
of
disease of the brain.
By the way, insurance companies cover recovery, don't what?
They are supposed to, according to the ACA and the parity.
The ACA meaning the Affordable Care Act.
The Affordable Care Act. And the issue is that they are supposed to provide the same types of services for substance abuse and mental illness as they do for other chronic medical problems.
But you said supposed to.
Yeah, but it does not always happen.
Is that the case?
Yeah, it doesn't happen quite frequently.
Well, the other issue too is that if you have insurance through the Affordable Care Act, the deductibles are very high for addiction. So a lot of people can't afford the deductibles.
So what happens? De facto, what goes on?
So then you call for treatment, and as soon as they find out you have insurance, you're no longer able to get funding through the state. So you lose funding and you can't pay your deductible. So you're out of luck.
And I've actually heard of parents who have children who the insurance would not pay, they had insurance, who took out second mortgages on their home to pay for rehab for their kids.
Carolyn, let's go back. You and I have had these conversations, and we talked right before we got into the studio about one of the things we wanted to accomplish with this program. And again, we went back to helping parents. From your vantage point, doing the work you do, and the effort to help parents, what are some of the signs that you feel, and I'll ask this all the way around, that parents should be looking for? Some signals and some signs that should say, hey, wait a minute. My child may be dealing with an issue, a problem that I need to be more engaged and involved in, and potentially reach out for some help.
You know, I think in general, and we're talking here about adolescents and a bit older people and young people in their 20s.
Yes.
It's very tough because our young people are growing up, they're creating more distance, they don't want their families as involved, and there are behaviors that change, but that's really the key. I mean, whether it's a mental illness that may be happening or an addiction problem, you're going to see changes in that person's behavior, your young person's behavior. And that would happen over a period of time. If they're beginning to isolate more, if there's less communication, if there's money missing from the house, if there are medications missing from the house. I mean, that speaks more to the opiates than it does to mental health. But staying in communication, it's difficult, but you really need to stay in communication and pursue some of these issues with your young people.
You know, it's so interesting. We have a son who's turning 13 as we do this show, and I'm not going to say too much because not that he watches that often.
He might, though.
We try to force him to.
Right.
Watches other public television. Try not to micromanage his relationships with other kids. But I get concerned. Yeah, I do get concerned. And my wife and I have this conversation all the time. How involved is too involved? If he's not with certain kids and all of a sudden he's isolated or isolating, is it by choice? I'm not sure. Does he care? Does he not care? He's a real strong kid, he's an independent kid, but how independent is isolated? I don't know. What's micromanaging? Help us.
Well, it was easier 20 years ago. You kind of knew who your kids were with. Now, with Facebook
By the way,
and
with all kinds of social media and stuff going on.
No way to follow that stuff anymore. I mean, I guess you could, but you'd have to really get investigative about it to figure that out.
But
then you're being
I mean, we were
intrusive.
doing things like.
What were you
I
doing?
mean, I mean, my son would, in the middle of the night, I mean, I never slept. I mean, for years, I didn't sleep. I still have problems sleeping. I would go, I'd be like, hear a noise out in the driveway, and they would be pushing a car down the driveway to go out, and they'd be pushing the car, and I'd be standing in the middle of the driveway waiting for them to push the car to me. I mean, they were crazy. I mean, I put GPS on the phone so I could track them. Then they figured that out, and they'd leave the phones, you know, they'd leave the phones somewhere, so I couldn't. I shouldn't.
So they
say
were
that.
good.
Oh yeah. They become very. Their brain is so. They want the drugs. They need the drugs so bad that they become so manipulative, and really convincing. That, you know, they really do convince you that you're crazy, and they're not doing anything, and you know they are, but it's hard.
Advice to parents right now. Anything else? I know there are no easy answers here.
Well, I think that another important sign is when you see that their awake and sleep patterns change.
Say that again.
When you see changes in their awake and sleep patterns, and that is that they are up all night long and want to sleep during the day. Oftentimes, that's what you see in adolescents and teenagers that are abusing
Why is that?
substances.
What's the correlation?
Well, because they're up using in the nighttime hours, and so they're up, they're feeling the effects of the substance, and then they tend to sleep in the daytime.
And Wayne, someone watching right now said, "Wow, that's tough. I feel bad for you and for your kid, and wish you the best for your kid, but not my kid. I don't see it." And I have to tell you something. I have said, "Not my kid." I will admit it. Not our kids. How delusional is that?
You never know. It's brain chemistry, and in the case of my daughter, you know, she suffered from a very severe case of bipolar disorder. When she was young and had it, they didn't even recognize it. Psychiatry didn't recognize it as a childhood disorder, so we could never get a diagnosis. Knew something was wrong. They never got it, and it turns out that heroin is the drug of choice for people with bipolar disorder because it helps them the most. And so she had a very severe episode after she got out of college, and then she started. The drugs for bipolar disease are very not great drugs with other side effects.
Right.
And heroin doesn't have those side effects and made her feel good. And she was a very severe heroin addict for probably 10, 12 years. And she was doing well on methadone. Last 7 years, she passed away about 2-3 years ago. She was 43. And that was a combination, I would say, more than mental illness. You know, I think people with mental illness live on the average 10 years less than the average person, right? Isn't that the statistic?
That, and they tend to die in their 50s rather than having a longer life.
Yeah, so I mean, it was a combination. It's all brain chemistry.
Yeah.
The mental
It's
health is
luck of the
brain
draw.
chemistry. It's the luck of the draw. What I always tell my other kids, you know, you won the dice when it came to your genes, you know.
So, and Carolyn, talk to us in the couple of minutes we have left. Parents who are saying, "Not my kid," you don't know what the brain chemistry is of your child.
You know, education is such an important factor here because parents tend to be, if we want to call it, in denial or just not seeing because it's terrifying. And one of the things that the Mental Health Association is so focused on in terms of changing the way things are happening is to provide education. This kind of program is a wonderful way for people to tune in and say, oh, I better look for that. But they can also, we have a call line called New Jersey Connect for Recovery.
It'll be up right now. Keep talking.
And we started that probably at the end of December of 2014, only around opiates. But we have two different lines. One of them is for people who are addicted themselves. And we have licensed counselors to talk with them and help them make decisions. The other is for family members. So when you call the line, there's a prompt, and you can either go on one or two. If you're a family member, we will stay with you whatever your issues are. And what we find is our families often are saying, I don't know whether this is an issue. Can you help me with this? And we hopefully do. And they call back and they get more help. We'll stay on the line with them. We will counsel and support them. They don't know where to go for that kind of information.
People don't know. We have a few seconds left. Some final message you want to leave to all parents right now?
Well, I think one of the things that I did learn is that there are certain learning disabilities, there's bullying, there's things like that that kind of lead kids to self-medicate, and that we need to be aware. I mean, I took my child to somebody with for ADHD and I didn't hear him say anything about, he did tell me, he did talk about addiction, but I never put it together.
Never put it together. Listen, you know, Carolyn mentioned a program like this. This will not be the only program we do on this. We have a responsibility in public broadcasting to continue to educate, but we can only do that with the help of professionals and committed people like yourself. Thank you so much for being with us. We appreciate it.
The preceding program has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of CAUCUS New Jersey has been provided by Steve and Elaine Pozycki, Wells Fargo, Caldwell University, PSE&G, Robert Wood Johnson University Hospital, the Robert Wood Johnson Foundation, and by Oscar Health Insurance. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. CAUCUS New Jersey has been produced in partnership with TriStar Studios.
New Jersey is a leader in solar power, and PSE&G is doing its part. With 24 solar installations in New Jersey, projects that are giving landfills new purpose and turning former brownfields green. Solar powers more than our homes and schools and businesses. It powers our economy by creating jobs right here in the Garden State. PSE&G, proud to support New Jersey.